Hey folks, Chad Duplantis with Dentist in the Know, and today I am here with a gentleman that I met a couple years ago. We actually have a mutual friend. This is Dr. Jonathan Spenn. Did I say that right?
You
Spenn?
said it correct. Very
Okay,
good.
I didn't want to, is it Spenn, but Dr. Jonathan Spenn. Uh, Jonathan is with the Christian and Medical Dental Associations, and that is something that I was involved in dental school. Quite frankly, I probably need to get more involved with it now, but it's a great organization. Before we get into that, just tell us a little bit about you and your journey in dentistry,
Sure.
and then we'll get into CMDA.
Sure. Yes, I graduated went to Southern Illinois University Dental School. Was involved with CMDA as a student. That was 2004 to 2008, and then did a advanced education in general dentistry in the Army. Was a dentist in the Army for about 8 years, and then just worked in public health dentistry for last 9 years or so, and then I've worked for CMDA uh, for about the last 2 years.
So
So
what is your role with CMDA?
Well, when I first started, I was the Midwest regional dental coordinator and then eventually the Northeast as well. So just covering the student chapters at the schools in those regions. And then now my role is the dental missions mobilizer and trying to facilitate short-term mission trip for student groups and also just encourage dentists to be involved in missions, both wherever they're at in their career. It could be a lot of it short-term, but even encouraging people to consider long-term as well.
So how big is the organization?
CMDA National has, don't quote me on this number, I think we have 13,000 members nationally, predominantly medical historically. I think on the dental side, we have about 1,000 members.
Okay,
So,
so 1,000 members, and then how big is the student component?
well, let's see. We have more students involved in our chapters than actually, many of them are not members of the organization. But um, I don't know. I don't know the exact numbers of that 1,000. How many of those are student members? But some of our student chapters we have Dental College of Georgia's like 50 students that regularly come, and then we have some that are just very small, maybe 5 students that meet.
I think ours was, back in the day, I want to say we had probably close to 100 that would come to the meetings over all 4 years. And then we'd have various mission trips. But, um, I think with what you do, I think it'd be safe to say that you're always seeking members.
Sure,
Okay.
sure.
So how does one become involved?
Well, right. Certainly. We are a member-based organization, so kind of like being a member of the AGD or one of those other dental organizations. We have membership. Obviously, for students, getting involved with a local chapter at their dental school. Sometimes it's coming on a short-term mission trip. There's CMDA has various events they do. We have a national convention coming up here in May. We have regional events. We have our dental missions conference in Dallas Fort Worth area that's coming up in September of this year. So we have try to have things that not a lot of students find out about us on campus as a dental student, but trying to walk along healthcare professionals their whole career, trying to offer things. There's something for everybody there all along their professional path.
So where are the missions that you all go on?
Sure. For student groups, we're trying to create things that are pretty simple, pretty straightforward. So Central America and the Caribbean, it's, one time zone, maybe,
Sure.
you can fly on a Saturday, 1 day travel, go for a week, Saturday to Saturday. Global health outreach. We have, trips that go just about everywhere. 1 week trips, again, are mostly close to home, but 2 week trips could be just about anywhere, Asia, Africa. And we work with Samaritan's Purse, there's a partner of ours, and they have a post-residency program for people who want to, consider long-term service, and they'll cover their first 2 years on the field. And there's like 17, give or take, Christian mission hospitals worldwide, and a lot of them in Africa. So for longer term, definitely opens up some more doors in terms of how long you're gone.
One thing that I learned this past year, Jeff and I were both inducted into the ICD. Jennifer was inducted the prior year or a couple years prior.
Jennifer Wade.
No, Jennifer Bell.
Jennifer, okay,
Jennifer
sorry.
Bell.
Okay.
Yeah, Jennifer Bell, our other podcast host.
Oh, sorry. Okay.
So no, that's quite all right. But one thing that I learned when I was there is that there are so many ways to give back,
Mm-hmm.
both in dental school and beyond. And, it amazed me as to the various missions groups that are out there. I mean, there are several throughout the United States. Um, but I'm going to say that this organization has been longstanding. It's a great organization. Um, from what I gather, it's a great way to kind of centralize, to give back, and to be able to continue to do mission work that's much needed. One of the last questions that I have for you is, do you all do a lot of mission work within the United States as well?
Sure. And that's where we have a lot of, it's interesting. It's not an either or,
Sure.
most of the people that I know that go overseas also volunteer in their own backyard. We have there's a partner called Christian Community Health Fellowship that is a network of clinics domestically. And that's usually where I steer people if they want to get involved locally. Samaritan's Purse is also launching this year, kind of like a remote area medical, where it's set up in a school or a church and do a weekend campaign, and they're going to be starting that domestically in the U.S. So there's opportunities, to get involved, both in your backyard and around the world. So there's lots of good dentistry. Just opens up a lot of doors. There's a need almost anywhere you go. So yeah.
Well, I think the world needs more Dr. Jonathan Spenns. One thing that I've learned from you in the short time that I've known you is that, you know, dentistry is what you make out of it. It's not always just sitting in a private practice, uh, you know, churning people in and out and making a buck. It's giving back in multiple ways. And one of the things that we didn't talk about, and I'd like to close with this. Tell us your career path and what you're doing currently in dentistry. How do you practice on a daily basis?
Yeah, I've had a very atypical career path. I was an army dentist for about 8 years. Worked in the public health, and I do kind of. I mean, I'm a general dentist, but I do a lot of like full mouth extractions, thirds, pre-prosthetic surgery. That's just kind of where I've ended up. But yeah, I enjoy dentistry. I have a different path than most people that my
But
age.
you work in public health, right?
I do. Yeah, I
Yeah.
work at a fairly qualified health center in Indianapolis. I work part-time, and it's flexible, allows me to travel. I do, travel with CMDA. So,
Well, I want to just close by saying thank you for your service to our country,
mm,
both in the military, and thank you for your service to our profession, and thank you for your service to those that are in need. The world needs more of you, man. Thank you very much. I appreciate it.
okay, well, thank you.
Yeah, it
So,
was great. And please look into Christian Medical Dental Association website.
CMDA.org.
How easy is that? CMDA.org. All right. Thanks,
All
Jonathan.
right, thank you.